Bismillahirrahmanirrahim. Welcome to my channel, Doctor's Gold. Today our topic is Waldenström macroglobulinemia. So first definition, in which muted or malignant B cells produce cancerous plasma cells. These plasma cells produce tons of monoclonal immunoglobulin M. And these immunoglobulin accumulated in the blood vessels lead to hyperviscosity syndrome. So hyperviscosity syndrome. So the symptoms may include vision problem like blurry vision, and poor circulation in brain. Due to poor circulation, symptoms include headache, confusion, and symptoms of stroke. Abnormal bleeding. High level of abnormal antibodies in Waldenström macroglobulinemia can damage blood vessels, which can lead to epistaxis and gum bleeding. Infections. High level of abnormal antibodies in Waldenström macroglobulinemia can slow the body normal antibodies production. This makes it harder for the body to fight infections. In kidney, high level of M protein can damage the kidney directly or through the development of amyloidosis that can lead to weakness, trouble in breathing, and fluid buildup in body. Sensitivity to cold. When exposure to cold can lead to pain, itching, bluish discoloration, or even a sore on the tip of fingers, nose, and ears due to reduced blood flow. Diagnosis. The most accurate way to diagnose Waldenström macroglobulinemia is using a bone marrow biopsy. And in bone marrow biopsy present abnormal plasma cells, which is daughter bodies seen in plasma cells. Serum electrophoresis. Here you see normal serum electrophoresis, and here you see in Waldenström macroglobulinemia you see a prominent M band present. Next we do urine electrophoresis. Also increase ESR, uric acid, LDH, and ALP. Treatment. First, chemotherapy used to treat symptomatic patients, and plasmapheresis to treat the sign or symptoms of hyperviscosity syndrome. Thanks for watching. If you like my videos, please subscribe my channel and press the bell icon.